Hi, everyone. My name is John Faulkner. I am your host of the Smarter Systems Better Care podcast. And I'm here today with healthcare strategist Andrea Corleto on Lyv Health, and she explores the future of health, business, and longevity medicine. Thank you for joining us today, Andrea.
Yeah, thank you for having me, John. Really excited to chat.
Absolutely, I am as well. So let's just get us started. Could you tell us a bit about your background, your business model, and clients that you serve?
Yes, of course. So I am the founder of Lyv Health. We are a women's longevity company. We do biomarker testing, personalized protocols, and ongoing support to actually help you take action with clinicians and coaches to support you along the way. My background, I'm more on the business side. So my background is primarily in consumer startups. I was the first employee at a consumer tech company. We bootstrapped to 200 million in revenue. Then I had my own health startup. So this is my second time founding a company. And it was very much inspired by my own personal journey of navigating a chronic health condition, trying to find answers, looking at the root cause. And it's sort of wanting to really dig into the data of what's going on with my body. And then, of course, my co-founder and our clinical advisors are more on the medical side.
Yeah, I didn't know that about you too. This is your second company that you started. Do you find it more appealing to tell your story if it's something that you've personally gone through when you're going through this now your second startup? Just curious how that works with your messaging.
Yeah, absolutely. I mean, I think that as humans, we're wired to solve problems that we ourselves experience. And so I think it makes me a better entrepreneur to actually build something that I wish had existed for me. And it makes me very empathetic to our customer. And then I think just overall, the story resonates because I'm not just doing this because it's a good business opportunity, although it is, but I'm also like, I'm willing to jump through hoops and run through walls to make sure that this exists.
Yeah, because as a founder, you have to be extremely passionate. You're going to have good days, bad days, roller coaster days, so on and so
Yeah,
forth, right? So,
exactly. Yep,
yep.
exactly.
And then, what's the core focus of your business today? Like, what role are you playing in driving that growth? Because I heard you're on more the operations side, business side. What are things that you're focusing on?
Yes, of course. So I'm the founder and CEO. So a lot of my role today is go-to-market strategy. How do we acquire customers? How do we spread the word about it? We're a relatively new company. We're focused on longevity care for women. So how do we build this community of people around us? And then, of course, finance, business stuff, fundraising, all of the good things to make sure we have money coming in and not too much money going out.
Yeah, that's excellent. So yeah, like kind of different approaches or channels or pillars or however you wanted to describe it that you're kind of navigating through this process and strategizing through. So
Yeah.
excellent.
Yeah. And I think that what the business requires at different stages varies. At some points, we really want to dig into, at first, we really wanted to dig into the customer pain points and understand really what do they want? What would be helpful for them? And then it's about actually making that happen, constantly getting feedback, refining. So I think perhaps the one thing that never changes is listening to the customer.
Yeah, absolutely. And uh, I know you're going through like a lot of different, things probably every day. If you had to explain like your competitive edge in like 30 seconds to somebody, what would you say?
Yeah. So we are the first longevity company to take a female first lens. A lot of the longevity companies out there, I won't name them, but they're very much focused on biohacking men who want to live forever. And that's great. But women spend 25% more time in poor health. And so I look at this actually through a health span lens. How do we increase health span for women? And that's our focus.
Excellent. Yeah, it sounds like you're definitely pioneering that space for sure. And like now that you're getting into this space, kind of taking a bigger pictures, zoom out, like what's one shift in your industry that you think most founders, operators are underestimating?
Yeah. Well, I mean, it sounds sort of cliche at this point, but I think AI. A lot of the solutions out there are very one size fits all. If you're having X symptom, we give you Y. We really want to personalize the experience. And now with AI, we can actually do that. We can actually take a ton of data from wearables, from blood tests, from medical data, everything, right? And connect the dots that quite realistically a human might have a really hard time processing such vast amounts of data. And so I think it really gives us an edge in taking medicine from just what is best practice to what is actually personalized to you, who you are, your biometrics, and also your lifestyle, right? There might be things that work better for someone that doesn't fit into someone else's life. So I'm really excited about just sort of more that personalization of healthcare.
Yeah, absolutely. And I think that's like a huge thing that we've talked about on this podcast before with the previous guest. Things that come up is like concierge medicine, kind of having like an Amazon like experience. You probably have heard that before. Really diving into the customer experience, because right now healthcare is not built for that model. It's more of like, let's get as many patients as we can be seen in an 8-hour time frame, right, in the clinic. So that sounds like
Yep.
something that you're really trying to focus on, is spend more time with the patient and understand their needs and customize it for them.
Yeah, yeah, exactly. And I think it allows us to do concierge medicine at a more efficient scale.
Yeah.
Concierge medicine, is typically for those who can afford 10,000 a year, but can we leverage AI and technology to make it more achievable for less than that so that more people can access concierge medicine?
Yeah, absolutely. Just making it more available, accessible for everybody.
Right.
So, and then how do you see, like, in this longevity space, people adapting to AI? Are there specific things you kind of briefly mentioned it, but there's other specifics that you see how they're implementing it and using it?
Yeah, I think it depends. I mean, there's a front-facing AI and behind-the-scenes AI. Front-facing, I definitely think customization or personalization, providing additional support, right, answering questions. A lot of times we leave the doctor being like, what did they say? What do I have? What do I have? Right? Like having AI actually then provide you a transcript of or a summary of your
Yeah.
conversation and what you have, your to-dos is actually really valuable. And the average American reads at a sixth grade reading level. So having AI translate what the doctor said into something that everyone can comprehend, depending on where they're at. And then I think there's a lot of really interesting uses of AI behind the scenes to make things more efficient, right? From a billing standpoint, process standpoint, just the amount of, I think one thing that has surprised me in the medical industry is how much admin time there is. We just think of
Yes.
the doctor's in, the doctor's out, and we think
Yeah.
that's the amount of time they spend. But there's so much more time outside. If we can reduce the admin time, I bet you we could reduce the amount of burnout and also just be able to serve more patients.
Yeah, because we talk a lot about provider burden on here, but it's really more like admin burden. That's really what we're kind of talking about, is because it's behind the scenes what the patient may not see their experiences in that brief appointment, but there's like a whole other major piece of that puzzle, right? So,
Yeah. Yeah, and none of us like to do the boring stuff, right? The
no.
billing, the charts, all of that. So it's good, There are some things that AI does that, that we're like, well, I could just do that. I enjoy doing it. But if I could do the things that we don't like to do, I mean, when it starts to like clean my house, I'll be really happy. But I'm also satisfied if it does a lot of the behind the scenes work.
Yeah, absolutely. And then is there anything specific, like we talked about your peers, like the industry, is there anything specific that you're doing today with AI to implement it in your business?
Yeah, absolutely. So we use AI for the personalization piece. So we allow it to look at all the data to really interpret what it means, what each biomarker means for
Yeah.
you in the context of everything else. And of course, we have clinicians review everything before it goes out to make sure it's accurate, but it just speeds up the process of connecting the dots and really personalizing the reports. And then of course, as we move into like the telehealth phase and providing those services, making sure that your clinician or your coach has a summary of the notes of
Yeah.
everything that's been going on before. So your last conversation, your next to do. It just makes the experience so much better when everyone can easily be on top of things because AI summarized it for them.
Yeah. And that's a great point you point out, like connecting the dots more quickly. It's not that you can't get there, it just expedites things at a level that we haven't really been able to witness before. So that's a good call out.
Yeah.
And then kind of getting back more like a systems and efficiencies too. Like, what are pain points in your operations today that you're experiencing? Because I know you've done this before. Is it like the same pain points? Are there new things in this longevity medicine space?
Yeah, so it's a little different. My last business was more on physical products.
Yeah.
Now that we are more on the tech side, I definitely think there are things that are inefficient in terms of systems. And I think particularly because we have to be HIPAA compliant, which is great. That also creates a lot of friction around how things are stored, how things are accessed. And so it's one of those things that perhaps it's good that it's inefficient because of the security piece. But I think that as we think about integrating with different systems and platforms, I think there's probably better ways to make things more efficient.
But yeah, of course, there's always opportunity to grow and make things run a little smoother, right? So
Yeah.
absolutely. And then, are there any parts of your workflow, that you just kind of wish ran smoother right now? I know you said you kind of just started, but I'm just curious. barriers or bottlenecks you guys are running into?
Yeah, that's a great question. So one of the things we're focused right now a lot is process automation.
Hmm.
When we started the business, we really wanted to feel very concierge. And so there was someone in the loop who is scheduling your blood test appointment, who is following up with you to schedule your call with your clinician, sending feedback reports. And we really want to automate that now as we scale. We're starting to get to the point where we're getting enough customers that it just
Yeah.
takes a lot of time to do all of this. So we will keep the element of concierge support, but there's a lot of things that could be automated that would just make our lives easier, like self-booking, direct integrations with the blood testing centers and all of that.
Yeah. Yeah, absolutely. And then as far as like, are you, what phase is your business now? Are you in like a pilot phase? Are you kind of like, it sounds like you're past the
Yeah.
minimum viable product stage. Are you like in the, I'm just kind of curious where you guys are at right now.
Yeah, great
Yeah.
question.
Yeah.
So we did our pilot over the summer. That went really well. We had an
Excellent.
oversubscribed beta. It was really exciting and sort of sad to have to turn people down, but there was only so many
Yeah.
so many customers we could handle. And as of last week, we are live to the public, which is really
Ex-
exciting. So we're
yeah.
starting to see people come
Congratulations.
in. Thank you. Yeah, it's really exciting. It's really rewarding, and seeing, strangers on the internet trust us with their health is really exciting. And I think we're starting to get some traction there. So at this point, it's all about we've laid out the MVP, we've tested it out. I think
Yeah.
there's a lot of things that can be improved. Like I said, automations and all of that. But we're at this stage where I think we just want to tell everyone about it and have them try it.
Yeah. Being an evangelist in a way, right? With through your
Yeah,
messaging. So yeah, it makes
yeah.
sense. And then, like, for example, now that you're past the pilot phase, like someone reaches out on your platform, are you still having like bottleneck issues there? Or are you kind of just taking everyone that's interested? Kind of, I'm curious about that, like intake process, like how that works.
Yeah, so the way it works is people sign up on our platform, they go to our website, livhealth.co, sign up for a membership, complete an onboarding questionnaire, and then from there we help them schedule the blood test appointment. Then they
Yeah.
receive their personalized report, and then they speak with a clinician. So all of that is ready to go. Whoever signs up immediately gets to do the onboarding. They get to schedule their appointment within a day or two. And then
Wow, that's really
typically
quick.
they get yeah, it's pretty quick. It really just depends on everyone's availability.
Yeah.
If there's and we partner with Quest and LabCorp, so there's always a location near you, likely within 10 minutes, if not 30 minutes. So it's all about what's your availability to go get
Yeah.
tested. And it's pretty quick, 15 minutes to go in and out, get blood tested. And then from there, it takes about a week to receive your personalized report that
Yep.
explains at high level what everything means, the status of metabolic health, heart health, hormonal health, and nutrients.
Yeah.
And then what are some specific things that our clinicians recommend that you can take action on, whether that's exercise, nutrition, supplements, or medications if needed. And then from there, we help you take action with clinicians. And we have a team of clinicians, including functional health experts, pelvic health experts, registered dietitians, and coaches to actually help you take action. And in
Yeah.
particular, people seem to be really enjoying the coaching model to have someone that's their partner on the journey that understands whatever symptoms they're feeling. A lot of our customers tend to be women navigating hormonal transitions, such as
Yeah.
postpartum or particularly perimenopause. So having that validation and in that accountability partner and person that gets you, that keeps you accountable, that provides recommendations, that seems to be really resonating.
Yeah, that's a pretty comprehensive process too. I was thinking at first is probably my incorrect assumption, like you just had one person they're meeting with, but they really have like a whole care team that are helping them, guiding them as their needs change or if they need something like an insertion in the process. Are you thinking about considering pairing up with like their existing like primary care, or how does that work? If, they say I'm working with this local physician, do you send your visit summaries or how does that work?
Yeah, so people can download the report and take it to their primary care. What we see
Okay.
a lot is that primary care clinicians typically don't have the time or aren't used to
Mm.
be looking at, we test 70 biomarkers. And so a lot of the times people come to us actually because they wanted to test things or felt sort of ignored by their primary care
What's the
and they want to
traditional
dig
method?
deeper.
Yeah.
Yeah, exactly. And
Okay.
they're more interested in the functional medicine approach. But of course, whoever wants to can take their data and go talk to a clinician. Also, if there's any sort of escalations, right? We have clinicians up to a certain point, but if one of the biomarkers is way out of range and we think that might signal to a condition or something that requires further looking, we would refer them to go talk to someone else.
Specialist or subspecialist. Okay. Excellent.
Exactly.
So what's working really well too, like right now? It sounds like what's working well is like you just launched, so that's literally brand new, like a week ago,
Yeah.
which is great. But like what's been harder than expected now that you've transitioned into this new phase?
Yeah, that's a great question. I mean, to be honest, I think the hardest part is managing time.
Yeah.
There's so many things that we could be doing,
Yeah.
and it's sort of a never-ending to-do list. And I think sometimes at night I'm like, okay, I need to put my laptop down and go to sleep, right? And so
Yeah.
like as a founder, prioritizing my health, my
Yeah.
sleep, knowing that I need to go to bed on time so I can get my 8 hours of sleep and then be my best the next day rather than running on low sleep and autopilot. But it's funny being in the health space and
Yeah.
having to remind yourself
Yeah.
to take care of yourself. It's a little ironic, but I think it's so exciting being a founder. And as you probably know, running your own business is sort of all consuming. And so sort of having to peel myself off the business sometimes.
Yeah, I definitely resonate with that feeling. It's an exciting feeling because you're building it. It's it's your baby in a sense. You're taking care of it
Yeah.
and you're making sure it's okay. But then having the realization it's okay to stop and get some sleep and rest, which I'm not always the best at, to be honest. But I definitely understand where you're coming from on that.
Yeah.
And then I know you guys are still like early on too. Are you guys starting to look at like KPIs or metrics or like I'm kind of curious too from a data standpoint. How do you know the needle's moving forward in the positive direction?
Yeah, for sure. So at this early stage, it's primarily anecdotal, people telling us this was really helpful.
Yeah,
I feel better. I did XYZ and I'm seeing improvement. But what's really exciting is over time, we will have a large longitudinal data set of what symptoms women have, what their biomarkers look like,
yeah,
and what that potentially signals to, what they tried, what works, what doesn't. And of course, all the data is stored safely and anonymized. But when we look at that data, as opposed to the lack of women's health research that there is, I
yeah,
think it's really exciting to think about what could we build with that in a few years from now? Could we build solutions that help women because we finally have the data that nobody has gathered? Could we then do clinical trials? Could we invent something new, right? I think it starts with that data, and it is really exciting to think about what that could turn into and the impact that could have in the future.
yeah. It could be revolutionary in a sense because you could get a lot of great insights from that information. And like you said, you can build research papers. You can maybe develop new products, things that would really speak to the market about their needs and what they want, and even things they may not know they need, right, from that
Yeah.
information. So that's like the alternative. And I think that's really the moment when people are like, the light bulb turns on. They're like, wow, I actually do need this thing. Like it makes sense. So
Right.
yeah, that's great. And then like looking down the road, I know this is a long ways in a founder's mindset, but like if you're looking 6 to 12 months down the road, what does success look like for you?
Yeah, that's a great question. I mean, to me, success looks like we have a lot of women who have joined Liv and who are feeling better because of it.
Yeah.
And so I think I quantify success as number of people that we helped that feel better. It's really rewarding when we hear someone say that they're feeling less tired, that they're able to show up for their families, or even that they feel validated when they get answers. A lot of
Yeah.
times women get told it's all in their head, but
Yep.
once they have the data, being able to say, I was right, there's something off and it's this, and now I can do that. I think that's really empowering too. So to me, it's all about the impact that we're creating.
Yeah. And I've heard like, anecdotal stories from friends, family, and others overhearing is like, they just don't feel well or that, general feeling they're just not feeling great and they can't figure it out. They've been to so many doctors and this could be like really impactful for them to get some answers at least about next steps they can take to help themselves feel better. Absolutely. And then like what's something like you guys need to figure out soon but haven't had time to tackle yet, like in your operations? Is there anything that comes to mind that you're like, we really need to figure that out? I'm sure there's a million things, but is there like anything that's like a top priority right now?
Yeah, that's a great question. Gosh, there's so many things, like you said, that we're figuring out. But I think one of the biggest ones is what is the right level of human versus tech support or
Yeah.
AI enabled support, right? We've heard that our AI chatbot is really helpful for when, you wake up anxious at 3 a.m.
Yeah.
and ask it if this is normal and what do I do, versus also the coaching sessions or the clinician sessions that are also really valuable to have that human interaction. So
Yeah.
something that we're still playing around with is what's the right mix of human and AI? What does that look like? When do you need one versus the other? So we'll continue to iterate on that, get feedback. But I think it's sort of even an overarching question on the future of health. When do you need a human? When do you not?
Yeah.
And I think that, health is something personal. I think there will always be a human in the loop, but to what extent and when?
Yeah. I hear that all the time too, is like the AI brings you so far, but you still need the human element to be a check, or like, I'm sure with the AI bot, there's an escalation point that it says, hey, you probably should, I don't know if you have on call with this, with your company, but there needs to be an escalation phase as well. So
Right.
yeah,
Exactly. Yeah.
absolutely. Well, thank you for joining us on the podcast. It was a great discussion, just diving into, how you guys are operating, how things are going, and looking in the future. Where can people find you at?
Yeah. Thank you so much for having me.
Yeah.
People can find us on our website at lyvhealth.co. So that is LYV health.
Excellent. Well, thank you for your time, Andrea, and really had a great discussion. Thank you.
Of course. Thanks for your time.